Hello everyone. Welcome to the lecture on recent advances in surgical technique. I'm speaking about the periodontal surgical technologies and all. We had two in. One is your microsurgery and other one is your lasers. We'll be dealing it upon the three parts of the lecture. The first part will be dealing about the microsurgical aspects, and other class will be continuing about the microsurgery part of a laser. The third will be your the laser applications. So what do you mean by microsurgery? Microsurgery is nothing but performing surgeries, that is the surgery performed under magnification. It's called microsurgery. We may be using a loop, we may be using a microscope, but by using this microsurgery, we'll have a precise surgical procedure so that I come to definition as such. Microsurgery is defined as refinement in operative technique by which acuity is enhanced through the use of a surgical operative microscope at magnifications greater than 10x. That should be the magnification is more than 10x here. So we'll develop a better profession here. There are two hallmarks in this procedure. The main hallmark is there will be increased visual acuity. We have a precise version of seeing a tissue over that, and then here will be improved manual dexterity also will be there. Then we have a precise operating skill with that. I mean the hand skill or ergonomics for maintaining the hand grasp will be more in microsurgery compared to regular surgery. So how it's going to do now? So how the visibility is going to increase there? When visibility is increased by tenfold, the motor precision will be increased from 1 mm to 10 micrometers. That's how the movement precision is going to be increased here. Coming to what is the philosophy of microsurgery? The main background of the philosophy of the microsurgery is there is enhanced motor skill for better surgical performance. So you're going to have a better surgical performance by enhancing motor skill. That's visual acuity is increased there. The precise hand grip is increased there. The other most important thing is the minimal tissue trauma. We're going to make a smaller incisions, reduce surgical fields. There'll be little information will be there, and good wound healing will be present there. And primary passive wound closure, that's micro suturing, will be done using these microsurgical procedures. When going to the advantages of using a microsurgery, the, the main better advantage is enhanced surgical decision making can be done with this procedure. And ergonomics, mainly the body posture advantages are present there. It's using a microscope, you can just sit in the precise position or at a standard position there and operate over the area. And there's a reducedness of the neuromuscular fatigue that's going to happen after doing the when you follow ergonomics there. And there's a technical improvement in the surgical performance in the area. Coming to the magnification systems, we had two magnification systems starting from the simple loops. Right now we're going to have working on a surgical microscope. The simple loops is nothing but you when we come across the loops where you're going to operate on the patients where it will be nothing but a plain glass placed distance area, and they have a magnifying loops. The magnification means we need to add up other glasses for that. And coming to surgical operating microscope, SOMs are there. So magnifying system starts from simple loops with a surgical microscope there. So we have three types of the magnifying loops. They works on the Kaplan optical system. Kaplan optical system is nothing but when the two parallel beam of light rays are converging at a point, this system is said to be a Kaplan optical system. Based on this Kaplan optical system, the loops has been classified into three types there. A simple loop, or a single element loop, or a compound loops, or a prism telescopic loops. We, when you see three pictures in the bottom of the slide there, simple loop is one. We have a single lens over which the light passes over that and hits the object. Where we're going to visualize the object there. Compound loops is nothing but here we're going to place two lenses there with a space or a reduced space between the two lenses there. Prism loops is nothing but we're going to place more number of lenses there, and we have to have better better magnification of the image there. So we'll be dealing about in detail about all the three classes of the loops there. The first comes with simple loops. Simple loops, as see the picture on the right side, it's nothing but a single positive side by side meniscal lenses there. Two lenses are placed. You can see it. Two lenses placed a distance from the nose track there. So through the no through the two lenses placed over that, we're going to visualize the object and operate there. But this got various disadvantages of that. One is they're subject to spherical and chromatic aberrations. Chromatic means nothing but the color aberrations are there. Spherical is nothing but the object is not able to precisely locate there or operate in that area. And which is because of this chromatic and spherical aberrations, there will be distortion of image there and area of operation will be disturbed there. Here the magnification can be increased only by augmenting the lens or increasing the diameter of thickness. So you need to increase the magnification. See if a glass is of 2x there, want to increase the magnification, you need to change the glass, place it as other glass there. And the size and weight limitations. Once you keep on changing the glass, the weight is going to increase over that area. Compound loops, this is a converging multiple lenses. That's nothing but this. We're going to place multiple lenses in that, but there will be intervening A spaces between the two lenses here. The because of addition of lenses, there will be increase in the refracting power, there will be increase in the magnification, and working distance and depth of the field will be increased, or because of adding the lenses here. Okay, and here we have got adjustable according to our needs there. Already lenses have been placed there, and they got adjustable knob over that, and without that there won't be an increase in the weight and the size of the lenses there. So it's already a prefixed one. It's a compound achromatic lenses. There is no chromatic aberrations can also not be seen over that. But the one thing is the magnification beyond 3 meters, 3 diameters only can be, sorry, it's 3 diameter only can be seen here. It's an achromatic lenses consist of two glasses pieces bonded together by a clear resin in that. Okay. The next, prism telescopic loops. It's an advanced type. It's better the simple, the compound, the prism telescopic. This advanced type. It's got a split or a rooftop prisms to lengthen the light path. So it's got lengthen the light path in that. It's got long channel type. It's got a series of switchback mirror reflections in that. Okay, there will be so many mirrors in that where the light will be reflected. When the switchback wind is going to reflect back over the other lens and the pass over that. Because of the multiple reflections of light in the lenses there, they'll have a better magnification, there'll be wider depths of field, the longer working distance can be well better appreciated here, and this is short enough to be mounted over either over glass frame and headbands. That's one main advantage of using a prism telescopic loops. And coming to the loop magnifications, the range of magnification of loops is from 1.5x to 6x. The magnification, lowest magnification is 1.5x, highest magnification is 6x. Less than 2x magnification, we are not able to visualize properly. And it is indicated for doing a microsurgery. So the matter is the for microsurgery, the lenses should be having more than 4.5x magnification. And more than 4.5x also it's very difficult to use because of small field of view and shallow depth of focus. It's clear now? So you can't use less than 2x and use more than 4.5x. That's more than 5x. So most periodontal surgeries will be performed between 4 to 5x. That's the range prefix for the loop magnification. They provide effective combination of magnification, the field size, and depth of the focus. So the magnification system for performing any periodontal surgery lies from the magnification from 4x to. Coming to the loops disadvantages, there are various disadvantages using a loops here. The main disadvantage using a loops is eye strain. You want to strain your eye because When you come to prismatic loops, you're going to put in our glasses there and see that you're going to strain your eye. There'll be fatigue there. The pathological vision changes also may occur over a long period of time, and the limited magnification. The one thing is we got to limit the magnification there. That's when if the loops is fixed to 10x there, 5x or 2x, that's the maximum magnification you can see. You can't adjust the magnification more than that. That's one disadvantage of that.